the main topic for discussion was whether the Health and Wellbeing Partnership Board should take on responsibility for social care as well, and whether they should become a commissioning role. So that was the main item of discussion, and it's only been agreed that in principle that there is broad support to look at this in further detail. So it hasn't been decided whether that's going to happen, but that certainly seems to be the way other local authorities in other parts of the country are going, so it's probably going to happen. There wasn't any mention of any timescale over it, but there is a fairly major review of adult social care which is going to be happening from next year, so I would imagine it will be in line with that. Well, I think it's worth mentioning that if the Partnership Board does become responsible for social care and becomes a commissioning role, it's probably unclear at this stage what the role of the partners will be and whether the composition of the board will have to change, and what will be the role of the voluntary sector is unclear at this moment. What was discussed was the smoke-free food and health and older people, and there's sort of mixed success in terms of meeting the targets, but we were given performance updates from the people responsible for those, and they're going to be available on the website. No future targets were mentioned. There was some concern over who's responsible for the national indicators, and we as a partnership board are not getting information on that. We're just looking at the local target. One of the indicators that was looked at was the KL131, the number of people aged over 55 who completed a structured self-care programme. This has been to the subcommittee, but they've not seen any improvement to date. So I think that is one of the indicators which is well below target, and I'm not surprised because it's probably very confusing and complex. The other targets that were looked at was the percentage of mothers initiating breastfeeding, and they're still waiting on some latest figures for that, so there wasn't a clear picture of whether that's on target or below target. And the other one that was discussed was 131, which is carers receiving needs assessment review and a specific carer service, and apparently there is a plan in place, but I'm trying to pursue that to find out what it is. The board agreed to transfer the delivery of the alcohol agenda to the Safer City Partnership Board. They felt it was more appropriate to be looked at there. And a presentation was given by, I think, Dr. Angela Raffle, I think that was her name, and she gave a passionate presentation on the harms of smoking and some of the successes that Bristol has been involved in, but still saying that there's still a long way to go. And there's been an initiative started at taking a peer-led programme into secondary schools called the Assist Project, and that's in an advanced state of implementation, and that Bristol has had some success in raising awareness through the media and working with Bristol City Council and the National Health Service professionals on this. The target now is definitely on getting people to give up smoking in their own homes. So there's an initiative now with health visitors to look at smoke-free homes and to discuss that with the parents, presumably, when they're going into the homes. One of the health-related issues that we're certainly seeing in the advice sector at the moment is an increase in stress and mental health issues with clients who are becoming increasingly anxious over either losing their job or having lost their job, losing their home. There's been a big impact across the city, and we're trying to monitor that as a service, as a sector, and we're also be working much closely with the advice network, which has now been officially launched, which is a really positive move to try and coordinate the advice sector, including all of the smaller community groups as well as the sort of main agencies. So and they had their official launch last week, so that's really positive. But I think that most agencies are reporting an increase in demand on services, inevitably because of the recession.